We are doing everything possible to attract them and then retain them, but still, it's not working.
What time did you come?
6 o'clock. My daughter is dead. Maybe 6 o'clock here.
The truth is, for over 10 years and counting, even though Western Region's population has been more compared to that of the Central Region has consistently seen more doctors in its health facilities than that of the Western Region.
You go to Accra, one person is in charge of maybe family planning, one is in charge of school health. But when you come to you scale it down to a place here, one person is a one-man contractor business.
We have only 2 theaters. One is non-functional because we don't have lights, one of the air conditioners is not working very well. So about 3 surgeons, we are using 1 theater, so we manage every day. Somebody will go there and, in the emergencies, and it's so difficult.
Our office is inundated with letters every single day. People wanting to move to Accra, to Kumasi, to Cape Coast.
Hello and welcome to Western Affairs. This show discusses issues of collective importance to the people in the western part of Ghana. My name is Obrimpoya Ampofo. Tonight, the healthcare delivery system in the region is up for discussion. Why? Because we don't have the right numbers in the area of doctors, nurses, and other critical healthcare staff. For how long has such a problem persisted in the region? What has been done? What isn't working? What needs to be done? And how are these shortages of staff manifesting themselves anytime you visit any of the hospitals in the region? Joining me to understand this is the Medical Director for the Nkwanta Regional Hospital, Dr. Joseph Tambiel. I will also be joined by the Regional Health Administrator, Dr. Thomas Tewia. Dr. John Jemfi will speak on behalf of the Ghana Medical Association in the region. And of course, we'll also hear from the longest serving medical surgeon in the Western region, Dr. Tewia Siame, and others. Now let's start. After the split of the then Western region, the present population stands at 2.2 million, and that's from the Ghana Statistical Service. This population is being cared for, according to the Ghana Health Service in the Western region, by 36 hospitals, 55 health centers, 109 clinics, and 398 CHIPS compound. Now, how many healthcare persons are distributed across these facilities? Dr. Tewia speaks in his capacity as the Regional Health Administrator.
For Western region, our total doctor strength is 149.
As at now?
As at now, it's 149. Yes. And then when we come to midwives, Western region has 775 midwives. And then when we come to the nurses, when I mentioned nurses of all types, we have the registered general nurses, we have the enrolled nurses, we have the degree nurses, all of them together. Western region alone had 3,810. The pharmacists in the Western region, we have 35. Quite low. Quite low. That's one of the professions that we find it very difficult to attract.
149 medical doctors, as we heard Dr. Tewia say. Now, if you decide to do a simple mathematics, you get to discover that a doctor in that part of the country, Central, is supposed to care for 7,878 patients annually. A single doctor in the Western region is supposed to care for at least 17,318 patients annually. How do these numbers manifest themselves anytime you visit any health facility in the Western region? What time did you come?
6 o'clock. My daughter is dead. Maybe 6 o'clock here. No. Go here.
Yeah.
Where?
Yeah.
Can I see doctor?
No.
Yeah.
Here, doctor. Number 1. Oh, this one here. It's finished. One day I'm coming.
Since the hands are few, at least the waiting time and other things will be very long, and people will not have this thing to come to our facilities. After all, they will complain that we go here and then we spend a lot of time there. So that will also then the burnout on the doctors, yes, because they are very few. A lot of them burn out because of the numbers. The overall impact will be that the mortality and the morbidity rate will still be high. Will still be high because the health professionals are not adequate, especially the doctors, are not adequate to take care of the numerous health problems in the region.
Not what we expect when you go to hospitals. You may be wondering, for how long has this problem battled in the necks of the Western region? We requested for data from the Ghana Health Service, and from the data they sent to us, you could see or you could trace the problem with the Western region health personnel way back in 2008. In 2008, Central Region had 72 medical doctors. In that same year, Western Region had 78. If you jump, as you could see from the screen, to 2015, Central Region had 246 medical doctors, Western Region 137. 2 years later, in 2017, Central Region's number of medical doctors jumped from 246 to 320. For Western Region, it jumped from 137 to 149 as we have it right now. What is so interesting is the fact that nationwide, if you take out the Upper East and then the Upper West regions, Western Region is the region with the lowest number of medical doctors. Greater Accra is leading with 1,583 medical doctors, followed by the Ashanti region, 822, followed by Central Region, 320, Brong-Ahafo, 277, Northern Region, 269, Eastern Region, 253, Volta, 242, Western, 149, Upper West, 56, and then Upper East, 47. What will be the possible consequences of this on medical practitioners in the Western region?
To have undue pressure on the few who are around, maybe one doctor serving maybe 50 clients will have to serve about 100 a day. You can imagine the pressure, yes, on the doctors.
No healthcare worker goes to work to say that today when I want to go and insult staff, or I want to be insolent, or I want to be rude to patients or kill a patient. It's often due to circumstance. Sometimes they're overworked. Sometimes they are stressed.
In fact, Dr. Joe Tambil is right when we look at these numbers. Between 2009 and 2017, the number of inpatient admissions, people who were asked to stay at the hospitals requiring extra care from medical doctors, there were 1,309,268 of such persons in hospitals in the Western region. 1.3 million. In that same period, you get to see that Central Region, the number of inpatients in healthcare facilities in that region stood at 900,563. Persons who went to the facility, the hospitals, and then went back the same day, the outpatient attendance. Between 2009 and 2017, there were 11,344,444 outpatients in hospitals in the Western region. If you check that of Central region, there were 8,720,361. Why am I talking about these numbers? Even though Central region has 320 medical doctors, and Western region has 149 medical doctors. Doctors in the Western region have been doing a lot of work, quite I mean, they're doing a lot of work in the area of caring for inpatients and then outpatients. They are looking after more persons, more than that of the central region. That's for quote unquote the regular doctors. Now, in June this year, the Regional Health Directorate called for a press conference. At that program, which was addressed by the Regional Health Director, Dr. Jacob Mahama, Dr. Mahama highlighted other critical healthcare staff that the region is lacking.
We lack consultants and senior specialists, especially in our referral hospitals in Nkwanta. Inadequate anesthetists in our various hospitals, usually 1 or 2 people doing 24 hours, 7. And then inadequate pharmacists.
But who are these persons? And what is the meaning of their absence in the region?
In the olden days, when an individual was going to go for surgery, the person was asked to write this or well. The reason being that there was a tendency for people to go to theater and not come back. They go and they die in the surgery. The reason was that there are certain precautions or precautionary measures which should normally be taken. Those days they were not done. Now we have what they call pre-operative assessment, where the patients who are scheduled to come for surgery are required to come through the anesthesia clinic. You saw about the retinal anesthesia clinic, yes. You pass through that place, you come with the anesthetist who will assess you. And what does assessment entail? Have you had a surgery before? Do you have any medical condition? Diabetes? Are you asthmatic? Are you hypertensive? Are you a sickler? This, that. Do you have a heart problem? You see, all this information is very important in that if we overlook all these things, it can lead to the death of a patient. The medications we use, the drugs we use, can worsen your condition. If you're asthmatic, some drugs can even trigger an attack. If you're hypertensive, some drugs can shoot up your BP. You can end up getting a stroke. You understand? So we have to be in the know of your condition to start with before we send you to theater.
Adding on to that is what happened to all of us in the region in April this year. In April, the only emergency physician stationed at the Nkwanta Regional Hospital left us. No, he did not go on retirement. He actually left. Who is he? And what is the meaning of his absence? What does it mean for the Nkwanta Regional Hospital Emergency Unit?
If you're a medical officer, a doctor, working in the emergency department, you say you're an emergency physician. Every doctor is a physician. But we also have what we call specialists. You can be an emergency physician, but not a specialist. So if you are an emergency physician who has gone to specialize, then we call you a specialist emergency physician. You are an all-rounder. All-rounder in the sense that any patient coming, you are able to intervene to stabilize the situation. A patient who has had an accident, bleeding, to the point of death, when they bring him, you know what to do to save the situation. Okay? You do the necessary things that can save the patient's life. A patient who has gone into shock, has bled profusely, is about dying. You know what to do to put the person alive. Yes, so the specialist is the one who has gone to do the course proper and get a certificate.
How long can that take before we get a replacement of him like that?
Oh, not that his presence or absence is going to collapse the place. No. So we are around. We are contributing in keeping the place running.
That's for what happens at the regional capital. So I decided to check up on how other districts are doing in the area of healthcare staff numbers. My trip took me to the Wasa and Memphis West municipality, as Nkregwa is the capital. Over here, I met Madam Magdalene, who is the municipal health director.
Ideally, every chief's facility is supposed to have at least 3 staff, an enrolled nurse, a community health nurse, and if possible, a midwife. But you go to, when you come to Memphis West, either an enrolled nurse is there manning.
The people who are the only persons manning those facilities, they do almost everything. What do they do?
It's not almost, they do everything.
From
from treatment, home visiting, everything, child welfare activities, whatever, everything.
So clearly, there are deficits with regards to the number of staff persons you have.
More than the word deficits. We have about 60% deficits when it comes to staffing.
The effect is obvious.
Because the nurses, they are 111 running there. If they want to go for their annual leave, you can only give them 2 weeks. And even the 2 weeks, you have to fall on other facility who are fortunate to have 2 staff for one to go there for relieving duties. And so the leave, if you say 2 weeks, they see you the director to be a very difficult person that and you can also not close the facility down or lock it till the person resumes. So that it's also a major challenge.
Now let's look at nurses. The problem with the number of healthcare persons in the area of nurses for the Western region started again way back in 2008, because in 2008 Central region had 2,104 and Western region had 1,753 nurses. Let's jump to 2016. Over there you get to see that Central region had 5,214 nurses. Western region that same year had 4,562. A year later, 2017, Central region had 5,818 nurses. It has jumped from 5,214 to 5,818. Western region, our number jumped from 4,562 in 2016 to 5,061. So from 4,562 to 5,061. If you go to the nurse to patient ratio, you get to see that in 2008, a nurse in Central region was caring for 913 patients. In that same year, a nurse in the Western region was caring for 1,458. In 2017, a nurse in the Central region is looking after 433 patients in a year. A nurse in Central region, in Western region is looking after 597. So 433 for Central region, 597 for Western region. Now, even though the number of nurses in the region aren't enough, here comes another challenge.
Nurses want to have further education, and so they tend to move to places where there's a university that does nursing, or some postgraduate course or the other. My office is inundated with letters every single day, people wanting to move to Accra, to Kumasi, to Cape Coast.
For nurses, they come, they report, but the problem is the attrition rate is quite high. Every now and then, you see letters, application for interregional posting to Greater Accra. It's coming now and then.
What really are the underlying factors why doctors and other healthcare staff aren't accepting postings to the region? Don't go away. We'll find answers soon. Welcome back. So why aren't doctors coming to the region? I sought to seek answers from the Regional Health Administrator, Dr. Effia.
We are all baffled. We know that Sekondi-Takoradi is a very nice city. We have a lot of things here. So when I was coming from North, I thought that here we will not have that problem. But they are here. I can say that the problem is more serious than even when I was in the Northern region. We don't know why. Our people, we get a lot. But in practice, only few will come and report. We don't know why. We are doing everything possible to attract them and then retain them. But still, it's not working. So let us take our time and do the research. Maybe there are some hidden facts we don't know, and the research will bring out all these things.
Let's seek answers from the doctors themselves in the region. My first stop is to the Effia Nkwanta Regional Hospital. Here, I'm going to meet Dr. Joe Tambell, who is the medical director.
Doctors want to be in a place where they'll be able to further their training. We know that in our setup, we are pushing everybody to go into specialization. And that happens after your basic training. After the basic training, most doctors will accept posting to a rural area or a deprived community. But they want to stay there for a short period and then move on to go back to the cities where they can train as specialists. And that is where the problem is. In Ghana at the moment, the only places you can train as a postgraduate is Kolebu, Komfuanochi, I think now 37 and other places are coming up. But all these places are in the big urban areas.
Well, Dr. Joe Tambiel is mentioning career development as one of the reasons why doctors aren't coming here. Let me go and find out from the Ghana Medical Association. And I'm going to talk to Dr. John Jemfi.
Accommodation for doctors is a huge issue in the region. There's a lot of work that needs to be done by the relevant stakeholders involved.
I want to understand this really from the longest serving medical doctor in the Western region, Dr. Terry Asiame. Many of you know him.
The system is not designed for purpose. I spent about a year, almost a year in the house just because of accommodation. Yes, I was sent to Effia Nkwanta, but then there was no accommodation for me. And I don't know anybody, I didn't know anybody here. So I was struggling, I would come, they said no accommodation, I'll go back, come, no accommodation, I'll go. So at the point I decided, no, I've had enough. So what I did was, a friend lawyer who was in Takoradi brought me down. We went around to look for accommodation, we were not getting. So we saw this woman. And then she said, okay, no problem. The only place she has is there. When you had the staircase, you see the staircase?
Yes.
There is a space under. They say they call it mid landing.
Yes.
And she said that's the only place she has for me. As a doctor. I said, no problem, I don't care. I can stay in that corner there.
Which place was this one? Which place?
It was at Chapel Hill.
Chapel Hill.
Exactly. I told her, no problem, I'm ready to stay there. The last time I remember one house officer was telling me that when he came, because of accommodation, he had to sleep in his car for some days, yes, because he couldn't get a place to sleep. You know, when you're a young doctor, it can be very difficult. Because sometimes you don't even have any money. People think you have money, but you don't have anything. You know, you might think that, oh, you could have gone for a hotel or something, but the salary is very, very small. And there are a lot of frustrations. Your parents for so many years, sometimes 6 years, 7 years, they spend so much on you. And, you know, it's not everybody who is coming from a very good background. So, accommodation is key.
I have my peculiar reasons for staying. It doesn't mean that I am satisfied with everything that is happening here. There's a general notion that people in the Western region are stingy. They are strong. They don't like saying thank you. If you are not careful, your own little money, you have to use it to buy medicine for the patient. If you go to other regions, Accra, Ashanti region, the patients show adoye. I mean, you only do something for them, they appreciate it. They will bring you a goat, they bring you yam, they bring you this. You see. So that's the difference between here and other places. So when people come here and they compare to other places, why should I kill myself here when I can enjoy it better elsewhere? So that's all the things, But some of us, we are not moved by that. We are committed to give our best for the region.
I'm also told of another problem. For which reason doctors aren't coming here?
In fact, most of our facilities could, better be resourced. For example, the other time the dental surgeons were complaining bitterly that there are no dental chairs to work with.
To be honest with you, the facilities have a lot of problems, a lot of challenges, so many of them, to the extent that sometimes even when we meet to discuss some of these issues, we get tired by the time we are about halfway through. So what we do is that we have bought our own equipment and implants, and then we find a way of helping the patient, because clearly, otherwise then you shouldn't be in Takoradi, then you have to go to Accra or Kumasi or wherever they have some of these things, and we can't all go to Accra. But for now, We have only 2 theaters. One is non-functional because we don't have lights. The air condition, one of the air conditioners is not working very well. So about 3 surgeons, we are using 1 theater. So we manage every day. Somebody will go there, and in the emergencies, and it's so difficult.
Are these the same problems facing districts outside the capital?
The road network, especially from Bode to Asankregwa, is horrible. Very terrible road.
How has the road affected the number of staff that you're supposed to?
Yes, when they post them, they refuse posting. Some will come. They will travel and come to the directorate to have a look at the place. You also welcome them nicely. Where you want to send them, we discuss at length. And they promise going, and they'll be coming back, and they refuse. You call them, they refuse to pick the contact that they give you. And the next time, they find their way out. You hear that they've been reposted to a different facility or different district. So this is the challenge.
This one is quite interesting. Marriage is actually one of the reasons why we don't have the right numbers.
For nurses, they come, they report. But the problem is the attrition rate is quite high because most of them, their husbands are in Greater Accra. So every now and then, you see letters, application for interregional posting to Greater Accra. It's coming now and then.
Those who also accept after 2 years, they want to join their spouse in a different municipality. And you can also not deprive them. You cannot deprive them. So you try and work it out for them to live. And at times you write that you need a replacement. And that doesn't even come in at all before you realize the release letter is in for the person to be released. It's only this year that we are fortunate to have 2 PAs. The male one, he wanted the wife to join him in Dwaboso. And I also opposed that and also asked him also to join the wife. Since if the wife can join him, then he can also equally join the wife. And lo and behold, he came. And the lady too also came to join the husband. That's how come we even had 2. And it's only this year, February, March, thereabout that they reported. Other than that, we'll be there without a single physician assistant.
When people marry around, they are likely to stay around.
Exactly.
So the men too should try and marry the women, and the women too should make themselves.
I mean, the healthcare women.
Exactly. So that they stay here because you are there, and then they are taking some of the doctors away, some of the nurses away.
Now we know our problems. How do we find solutions to ending this drought of healthcare persons coming to the Western region?
Western region ought to have a teaching hospital because when you have a teaching hospital, that's when you can train specialist doctors, and that will attract more doctors into that region, and they are more likely to stay because they've gotten used to the environment. They are likely to stay after their specialization and all that.
Kumasi has Konfanochi. There's a concentration of doctors there. Accra has 37 and Kolebu teaching hospitals. There's a concentration of doctors there. Cape Coast has Cape Coast Teaching Hospital. There's a concentration. So clearly you can see a trend. Okay, so yes, it is a factor, a major factor in attracting doctors to the region. When you have to do postgraduate training, you have to do it in a teaching hospital. And if there's a teaching hospital, it will go a long way. It will go a long way.
Effia Nkwanta is big enough to become a teaching hospital. So I think that that agenda must be seriously pushed by all the opinion leaders, all the people who have a say in the Western region and the Western North to make sure that this thing will happen.
If we can take a cue from the central region and the fact that they had a new hospital and they had all the equipment and they had all the human resources and all the accommodation and all those things that accompanied the structure, and because of that they have high numbers of doctors Because the human resource is central. The human being is central. I mean, whatever you have, if the human beings are not there, it's useless. So we should be able to attract more doctors and other healthcare workers, nurses, and other healthcare workers to the region. And one of the ways we can go about this thing is to I believe that we should have a new place. This place is not helping us, but our numbers have been dwindling over the years. And when this thing is being planned, they should take care of the accommodation, they should take care of the equipment, they should take care of everything, so that when we come, I mean, we will have that peace of mind to work and give a good service to our patients.
There should be equitable distribution of the staff. You go to Accra and some places are choked. Some places are choked. You go to Accra, one person is in charge of maybe family planning, one is in charge of school health. But when you come to you scale it down to a place here, one person is a one-man contractor. One-man contractor business.
People ought to learn to put away their differences. The people in the region must be, and that includes the leadership, must unite and forget about NDC, MPP politics, forget about chieftaincy, I support this person and all that. And if we are able to rally together, the Western region can change, can become the best region in this country. I mean,
so obviously
the potential is there.
Obviously, it is the people themselves who are bringing these things to themselves.
Yes, I think we are disunited, and I think we also need leadership. So let's come together. The NDC, MPP thing doesn't help. The chieftaincy disputes, I'm supporting this, I'm supporting that, and will not help anybody. You see, when you begin to speak in one voice, you are heard. You become louder and you are heard better than when everybody is pushing their own agenda here and there. So let's have the leadership.
Now we know the areas we need to work on ourselves as residents in the Western region. When you meet the next politician, when you meet that chief, when you meet that person in authority, you know what to demand. This is Western Affairs, the show dedicated to discussing issues of collective importance to the people in the western part of Ghana. My name is Obrempoya Ampofo. Do subscribe to our channel. Thank you for watching.